So we see that the numbers of COVID-19 are back. We have just experienced one of the highest weeks since the summer of 2020. We recognize that there will be other elements in the fall and the winter that will also impact us. The flu, possible exposure to pneumonia, allergies, and other respiratory illness. Please take good care of yourself. Make sure you're following the protocols, sanitizing spaces, washing your hands, wearing a mask. It is so important. It has been said that this can reduce your opportunity to be impacted by COVID by over 75%. We wish that all people would do it, but for those who don't, we can't hold them accountable, but we can hold ourselves accountable for wearing a mask. Please take the necessary precautions. We recognize that COVID-19 continues to impact African Americans at a much higher rate than any other individuals. It is so important that we take responsibility for ourselves. God bless you, and God keep you.
Good afternoon. I'm Doug McGowan, representing the Joint City-County COVID-19 Task Force. Today I'm joined with representatives from the Health Department, David Sweat and Dr. Lisa Householder, as well as representatives from the 4 big hospital systems that we have here in Memphis and Shelby County. You're going to hear some data today, folks, and I wish I had better news to report, but unfortunately, the status of the pandemic in our county is getting worse, not better. If you could show the slides, please. You'll see that our case rate is going up pretty substantially over the last few weeks. You'll also see that the hospitalizations are going up relatively steeply compared to where we were before, if you could advance the slide. Those are very concerning to me. They are concerning to our hospital leaders, to our elected officials, and they should be concerning to you as well. Unfortunately, we're also going up from a floor that is not as low as it was when we started in the spring. So we're starting from a higher place. I understand. You are tired of the pandemic. I'm tired of it. We are all tired of it. But I know that we can do this. Together, we can do this. Our country has a history of resolve. 80 years ago, our grandparents and great-grandparents came through the deepest depression that our country ever had, and then faced a global crisis and a global threat successfully immediately after that. They had to sacrifice so much to come through and be successful in the face of that threat. It's our turn. It's our turn to show resolve in the face of what is a different, but still a global threat. And I say again, we can do this. The good news is that our medical community is going to come up with a vaccine at some point. But our job, they need us to help keep this pandemic at bay until that vaccine is developed. Shortly, you're going to hear about it from our hospital partners, about how critical it is that we all do our part to keep those numbers down so that they can keep all of us healthy and to keep our hospital systems from getting overwhelmed. We can do that by doubling down on the compliance and doing what we know to be the right thing. That's the other piece of good news. This is not magic. We all know what we need to do. Wear your mask. Get tested. When I say get tested, it's free, it's easy, and it's for everyone. It's available for everyone, so please get tested. Wear your mask, get tested, socially distance, avoid large gatherings, and please do not go to work if you are sick. Now, what I'm saying, I realize, means there are sacrifices that you are making. If you could put up the next slide, we are trying to do everything we can to ameliorate the impacts of those sacrifices. There are resources for you. If you can't go to work and you can't pay your rent or your mortgage, there is mortgage assistance and rent assistance available to you. If you can't make your utility payment, there is assistance available to you. If you work in several industries that are dramatically impacted by this pandemic, the personal care industry, the hospitality industry, we have assistance for you. If you're an artist, we have assistance for you. And also, if you're a small business, we have assistance for you. Now, I realize there's going to be a myriad of different websites that you could go to, but I'd ask you to remember one thing, 211. If you are in need of assistance, please dial 211. We have operators there from the City of Memphis who will answer your questions and direct you to the appropriate resource. I'm going to stop in a second here and introduce David Sweat and Dr. Householder to give you the data and the facts on how the pandemic is progressing, but I wanted to take just a minute to offer this. I think in too many cases, we believe this is about strangers passing the disease to strangers. But folks, this isn't about that. This is about us. It's about you and me and our family and our friends. And unfortunately, in way too many cases, we are giving this to each other. Yes, unintentionally, but we're giving it to each other. And I understand why that is. When you get together in small groups with people you love and care about, you can't imagine that someone would ever do you harm intentionally or unintentionally, and so you let your guard down. You don't wear your mask, you don't socially distance, you get that long-awaited hug that you have not been able to engage in for quite some time. But we can no longer assume that we're COVID negative. You can't assume that you are. You can't assume that your family is. Go find out your status. Please get tested and know. We don't know where people have been. Wear your mask to the extent that it's practical when you're in those small groups, and please, in addition to avoiding large groups, let's not substitute that with lots of small groups. We can't let our guard down while we're together. And so especially as we enter into this holiday season, there's going to be increasing pressure for us to see each other. Please keep in mind that if you care about each other, you will know your status, you'll encourage other people to get tested, you'll wear your mask, yes, even in your house when you have other folks that you haven't been isolated with, and you will socially distance and have a great time. The next 6 weeks are critical. If we can double down, I know that we're going to make progress. So with that, I'll turn it over to David. We need your help, folks. We need your help. David.
Thank you, Chief McGowan. So in terms of the data, if we could pull up the first slide, I'll go ahead and show you the graph. We are at 37,192 cases that have been reported in Shelby County as of yesterday. That represents 188 new cases yesterday. And we've had 570 deaths. Right now we have 2,853 active cases in Shelby County. Now, the thing I would note about this, you can see on the graph that the cases have started to increase. This mirrors the trajectory of increase that you saw in the hospitals. This is based on the reported cases by their specimen date of collection. Overall, our test positivity rate right now is running about 7.2%. And 35% of the cases are being diagnosed in individuals who are 18 to 34 years old. So more than 1 in 3 of the people who contract COVID-19 disease in Shelby County are in between 18 and 34 years old, young adults. That represents the highest single group demographically for who's got the virus and who's giving it to each other and to the rest of us. But when we look at the death data, we see that 88.8% of those who have died are 55 years of age and older. But of course, we are intergenerational in our relationships. We're intergenerational in our households and in our work environments and in our social environments. So it's really important for all of us to take all the precautions to protect each other from the worst outcomes that could occur. Now, if we could look to the next slide, please. Some of the things that we've seen in an analysis this week of the first 704 individuals who were interviewed with the new interview tool that you've heard us mention before in these briefings, we see that 78% of the people had symptoms, but 22% of the people that we have diagnosed had no symptoms. They were diagnosed because they were tested either in a screening process or because they were a household contact or a known contact or some reason came up, but they weren't sick when they got tested. That represents 1 in 5. So 1 in 5 individuals with COVID-19 disease that we have interviewed recently have no symptoms. That's why we have to always take precautions all the time, regardless of whether we feel good or we don't feel good, whether we feel sick or we don't feel sick, because we still could be infected with COVID-19 and we could be sharing that virus with other people. Next slide, please. When we look at the workplace settings for the people who have been diagnosed, We see that the three biggest single work settings are healthcare settings. 22% of cases report working in a healthcare setting. 12% of our recent cases have worked in school settings, and 14% have worked in manufacturing locations or warehouses. So those occupational sectors are overrepresented in the sample of people who we have recently interviewed, meaning that the people who work in those locations are perhaps at greater risk of transmitting the virus or encountering the virus. They're certainly overrepresented in the sample of people we have interviewed. Next slide, please. Now, I mentioned that 78% of people that we've interviewed recently had symptoms. Well, let's look at some of the activities that people have engaged in during the period of time when they were infectious, and these are among symptomatic individuals. When you add it together, 63% of the people that we've interviewed either were socializing with others in their home or in someone else's home or in some other social setting, or they were participating in a sporting or recreational event. Also, we see attending place of worship or going shopping and other activities, but these are people out and about, engaged in their normal day-to-day activities of life, regardless of whether they have symptoms or not. These are all symptomatic individuals. So people who should be staying home should be isolating and protecting others from coming into the virus that they have in their body, and yet they're out in the world engaged in activities. Next slide, please. When we look at that a little more deeply, we see this concentration of participation in sports, socializing, and also going to gyms and domestic travel. That's another feature that came out of the data this week, where we see people who are in their infectious period and they go on a trip. They leave Shelby County and they go somewhere else. That was a feature that we found in the data just this week of the recent people that have been interviewed. And then next slide, please. Or if that's the last slide, we can return back to the screen. When we think about the ways that we can protect ourselves and each other, I just want to remind you, the most important thing you can do is, if you are symptomatic, is stay home. And if you are outside your home, regardless of how you feel, it is desperately important that we all wear a mask. With that, I'm going to turn it over to Dr. Haushalter.
Thank you, David. And you're going to hear some repetition, but we think it's important today to hear from a variety of us on the same topic. I'm not going to cover any data. I just want to reinforce some key messages that's based on the data. But also I want to address what I would think your concern is, and that is whether or not we're going to shut businesses down or begin to limit businesses again. And so one of the key takeaways today is that if we all do our part to protect ourselves, each other, our families, and our communities, we can move forward without impacting businesses to the degree that we did earlier in the pandemic. So some of the key takeaways that you've heard both from Chief McGowan and David have to do with masking. I want to reinforce what I said Tuesday. There are many counties that do not require masking. It's important that wherever you travel that you wear your mask, regardless of whether it's required or not. Clearly you want to wear them in public places, but as we've been saying more and more lately, as you have guests at your house or perhaps you visit somebody else's home that you don't live with, it's really important to wear a mask and social distance. And I want to highlight what we haven't heard today is that we really want to protect our most vulnerable populations. So as our numbers continue to go up and we continue to have transmission, we're going to see more cases in those who are seniors, so people above 55, and those who have chronic illnesses. And we know that they're going to suffer the worst outcomes from the illness. So really wearing a mask when you're around others, and particularly those who have chronic illnesses. We've talked a lot about social distancing and hand washing, so I don't want to speak to that. I do want to talk about limiting social outings or gatherings. We do want people to frequent our local businesses, but if you choose to go to a restaurant, really try to go at a time of day where it's not as busy. Wear your mask at all times with the exception of when you're eating or drinking. And those are things that will reduce transmission to those at your table, but also to those who are employed. Also, as we come into the holiday season, we're all looking at how we can spend time with family and friends. So you really want to think through your holiday plans currently. You want to limit the number of people who are in your home, or if you're going to someone else's home, generally you want to limit it to your household and perhaps one other household. So that does change our traditional holiday season, but it's important this year that we begin to think about that and plan now, but also to stay home if you're ill. So if you have any signs or symptoms, you may at the last minute opt not to participate in a holiday event because you want to make sure that you're not spreading it to others. And then I want to reinforce what was said about not going out and about, going to work, going to church, going to other places when you have symptoms. What you're probably thinking is, how do I know that it's not a cold? How do I know it's not my allergies? I've said before, there's all of us have had the flu or a cold, and we say to ourselves, I'm not feeling like myself today. When you have that thought, that's really the day that you need to stay home. Any symptoms that are COVID-like symptoms, so that's cough, fever, some people have sneezing, obviously the loss of taste and smell. Those are reasons that one should stay home and surely get tested, and then wait until that test result comes back before you do anything else. Next week, you're going to hear more about assurance testing, or what we call targeted surveillance testing. This is something that employers can offer to employees. It's regular testing of individuals who are asymptomatic so that cases can be picked up quickly, isolated, and quarantined. What we wanted to do today was to bring our hospital partners. We are all in this together. It takes governmental agencies like the health department, as well as our healthcare systems and many others, to make sure that we get through this pandemic. So I'm going to turn it over to Dr. Keith Norman, who's going to speak a little bit from the healthcare perspective, and then we'll have other healthcare leaders join us.
Thank you, Dr. Haushalter. On behalf of Baptist Memorial Healthcare and the 19,000 employees who have worked tirelessly to fight this pandemic since day one, we come to reaffirm our commitment along with the other major healthcare partners here in our community. With over 22 hospitals in this region and 12 in the Memphis, Arkansas, and Mississippi border area, we realize that this virus is spreading in communities near our city and county. We're encouraging all of those partners in those communities, our friends, our families, our loved ones, to please follow the protocol of the health department in your area. And if there is no protocol, if there is no mandate, create your own. Wear a mask and keep social distancing as a part of your daily practices. We've conducted over 300,000 coronavirus tests here in this community, and we're not tired. We're ready to win this fight. We realize that by working with government, working with the Shelby County Health Department, our mayors, and each other, we can tamp down and stamp out this virus. We encourage you to please follow those protocols and to work hard and tirelessly. Finally, if I may change hats for a moment, I also speak with the faith community. There is a very familiar scripture that says, "Do not let us lose heart in this season. For in due time we will win if we don't grow weary." We acknowledge that COVID fatigue is real. Seasonal affective disorder, sadness comes at this time of year. But we would like to affirm and acknowledge that it's not just impacting you, it impacts all of us. But we recognize that it is necessary to remain vigilant. When we consider the alternatives and the possibilities of long-term illness, or even worse, the loss of life, it is far more important that we remain vigilant and fight together. Let me encourage each and every one of you to remain vigilant, to remain committed, and let's win this battle together. We're working together, we're fighting together, we will win together. I'd like to now invite my colleague, Dr. Cassandra Howard, to the podium to share her thoughts.
Good afternoon. I'm Dr. Cassandra Howard, Vice President, Chief Medical Officer for Methodist Le Germantown Hospital. I'm here on behalf of my system, Methodist Le Healthcare. The trends of the new COVID cases we're seeing now are definitely cause for concern, but we're prepared if cases continue to climb. Towards the beginning of October, Methodist Le Healthcare had its lowest number of COVID inpatients since the peak that we saw in the summer. We were at 57 inpatients at the beginning of October. In less than a month, the number of patients has more than doubled. As of this morning, Methodist Le Healthcare has 121 COVID inpatients across the system. We have capacity to meet the needs of the community now. We also have surge plans in place at each of our hospitals. A benefit of being a part of a large hospital healthcare system is that we can move patients from one hospital to another if needed to ensure they get the best care possible. We have had significant successes with staff recruitment and continue to aggressively recruit additional staff members. We are in a critical moment right now with this pandemic. While we all may be suffering from pandemic fatigue, we can't lose focus. I can't emphasize that enough. We can't lose focus. We must continue to wear our mask anytime we're in public and around people who do not live in our immediate household. That is in addition to socially distancing and staying 6 feet apart, washing your hands frequently, and disinfecting surfaces, public surfaces that are touched frequently. Equally as important, please stay home if you're not feeling well. My closing sentiment to you is please partner with us and do your part outside of the hospital, and we have you covered inside of the hospital. Next, I'd like to introduce my partner in crime, Dr. Martin Kraus, the Chief Medical Officer at Regional One Health.
Thank you, Dr. Howard. See, it's very easy to just wash your hands as soon as you encounter past a container. On behalf of Regional One Health, I do want to thank the city and the county and everyone involved with this, our hospital partners as well. I would just like to reemphasize a few things. There's really only 3 things that we can do to combat this virus. One is wear your mask. It's really quite simple. We wear a mask. I'm a surgeon initially before I entered this role, and frankly, wearing a mask is just not that big of a deal. You just wear it, and that not only protects you, but it protects others as well. It is not a sign of weakness. It is a sign of actually caring for our fellow Memphians, our fellow Shelby Countyans, our fellow Mid-Southerners, our fellow Americans, for goodness sakes. So wear our mask. Wash hands. Again, quite simple. Whenever you pass a dispenser, just reach over, flip it, and wash your hands. Very simple thing, but very effective at combating this virus. And finally, stay apart from each other. With the holidays coming up, it's going to be very difficult. As mentioned earlier, it's nice to get that hug from the long-lost aunt. But we can't do that. We just can't do that this year. And in order that we can do that next year, we have to act now so that we can get ahead of this thing and stamp out this disease. Only by working together with all the hospital partners, with the city and county government, with our neighbors, and with our friends, we can come out ahead. Finally, I just want to mention one thing, that frequently we all have our antennas up when we're at work, because there are people around and they'll say, hey, put your mask on, or don't forget to wash your hands. But sometimes we let our guard down when we leave our place of employment or wherever it is we happen to be. That's where this thing is. It's like, just imagine there's a bear behind every corner, and it will sneak up and get you. So please, we must stay vigilant the entire time that we're awake. I'd like to now introduce Jennifer Chisano, who's the Chief Nursing Officer at St. Francis. Oh, one other thing. This is not wearing a mask. This is wearing a mask.
Thank you. Well, good afternoon. I'm Jennifer Chisano. I'm the Chief Nursing Officer at St. Francis Hospital in Memphis, and representing St. Francis Hospital Memphis and St. Francis Hospital Bartlett. Please, I'm not going to go over everything that's been gone over so well by my colleagues here. Thank you to the Health Department, Doug, everyone here. They're doing an amazing job, by the way, this team. I do want to comment that the teams are working so well together, these health systems. Thank you. It's an honor. Wearing your mask, I can't emphasize enough. It's not political, folks. Please, I'm begging you, I'm imploring you, wear your mask. Social distancing is incredibly important. Even if you're in conference rooms, break rooms, you need to be spread out when you have meetings and things like that. It is still out there. We're all happy to take care of patients. We want to take care of patients. It is heartbreaking to see patients die from COVID. I've experienced that. I've experienced colleagues die. Please, I beg you, wear your mask, social distance, and remember, go to the health department websites. They're here to help you. We appreciate you, and stay safe. Thank you.
We have a few minutes left, so we want to open it up for questions.
Tony Salone with Fox 13 Memphis. Tony, we'll come back. Bradley Broders with Local Memphis 24.
Thanks, everyone. Good afternoon. I spoke with Baptist and Methodist folks yesterday about their going back and kind of looking back over the surge plans. I'd be curious for St. Francis or Regional 1 if you could just sort of weigh in on your surge plans and maybe more broadly, how unsustainable is this if the numbers keep going up, the surge plans are going to have to be implemented, that we're looking at the field hospital potentially needing to open?
Thank you. We do have a surge plan at Regional 1 Health. The one thing we have to be cognizant of is that Regional 1 Health is probably not going to be able to take on as many patients as our colleagues in town, because many of those beds are filled with trauma patients or burn patients or high-risk OB patients, which are somewhat unique services that are provided by the hospital. That being said, we have a surge plan that is in place. It has not been implemented as of yet, and hopefully we will not have to. I think that if everyone follows the plans that have been laid out, the mask, social distance, wash hands, then hopefully none of our hospital partners will have to implement such a surge plan.
Brad, did you have a follow-up question?
Yes, I didn't know if St. Francis could weigh in about their surge plans and their, I guess, concern level or planning what they're seeing.
Yeah, I think for a surge plan, I mean, certainly, I think supplies, we have enough supplies, we have enough beds. Our biggest concern is manpower. Even though I think some of our health systems have been able to get people to work, but manpower is a big concern because a lot of the nurses in our community are traveling, helping out different parts of the country that have been horribly affected by COVID. We've done a relatively good job here, but that's our concern, is having enough manpower.
Kelly Roberts with WMC TV.
Good afternoon, everyone. I wanted to ask about just that alternate care facility. Once again, I heard from a doctor that possibly if we're going in this kind of trajectory, that maybe that we could see that site be open in 4 to 6 weeks. Is that a trajectory that looks to be possible?
Well, I'll address that. It is our hope that we never have to use that facility. We are prepared to use it if we do. The first thing we're going to do is to ensure that, A, we tamp down the numbers so that our hospitals do not get overwhelmed. B is to surge in place at our hospital systems, and that means opening additional beds to serve additional patients, getting the staff that we need so that we can surge in the hospitals. That is the most efficient and effective way that we can do it. Third would be to go to that alternate care facility. We do have leadership in place. We have plans. We are working with the state of Tennessee, with the state health department, in order to get staffing that would come in and staff that up. As far as your projection of the time, certainly if this thing went out of control, you could project the timeline and you would probably be relatively close in that estimate. But I am convinced that together we can come together as a community, as we have done before. We can stem the tide. We can drive the numbers down at our hospitals so they do not get overwhelmed, so they don't have to surge in place. So any other questions?
Kelly, did you have?
Yeah, I guess, yeah, sure. I'll ask just one more. And, can you talk again about the stock that you put into these 24-hour daily COVID-19 counts? For example, from Sunday to Monday, we saw over 400. Today, over the last 24 hours, we saw 188. Is that any kind of indication, even though we see that the cases are going up, the fact that the 24-hour count has been cut in half within this week, does that, predict anything or give any kind of projection on the way that this is going? Or are there more the other numbers or other rates that you put more stock in to project, where this thing is going?
I'll let David answer the day-to-day, but we're looking for trends. As you know, this is a 14-day timeline, so you really need 14 to 21 days to really get a good sense of the direction you're going. But outcomes are important. If our case rate is going down, but our hospitalization rate is going up dramatically, that means the outcome is that we have many more sick people in the hospitals that we have to treat, and that's what we're trying to avoid. So, David, I'll let you talk about the day-to-day versus the long view.
Sure, thank you. Thank you for the question. What I can tell you about the rhythm of data, the data stream, is obviously once the sample is collected, it takes 1 to 3 days before that result is reported. So if you think about the rhythm of the data stream, on Mondays and Tuesdays and Wednesdays, you're reflecting the numbers of people who got tested on Friday, Saturday, and Sunday. And so it's not surprising to me necessarily that we had the numbers go down on Wednesday, because really the bulk of those individuals that were resulted yesterday would have been individuals tested Sunday, and we know Sunday is a light testing day. But then we know that Monday and Tuesday are more heavily utilized for testing, and today and tomorrow is when those results would be coming in. So I would be expecting the numbers possibly to be different on Thursday, Friday, Saturday, reflecting testing that occurred during the week. So there is a rhythm to the data stream, but what we know overall is that right now, over the past 7 days, we've been averaging about 300 plus cases per day. And under some metrics, and others say as well, it's about 270. It kind of depends on which data source you're relying on for that. But either way, it's up. It's up over what it was a week ago. It's up over what it was two weeks ago. And when we look at our 14-day trends, all of them are escalating upwards. And so what we are concerned about is also in the hospitals, there's a data lag or a lag between when people get sick and when they need hospital care. And so the first few days of illness is perhaps people are sick, but they stay home, they're handling it. And then things get worse on days 8 to 15, and that's when they go to the hospitals and need to seek care. And we've been rapidly seeing the numbers of people in the hospital go up. And we've also seen that the contribution of the patient population mix is varied. And we've had anywhere from 23 to 41% of our hospital patients are coming from the surrounding counties. So as I've said before, it doesn't matter whether the law is requiring where you live that you need to wear a mask as to whether you should wear a mask. You should wear a mask if you're anywhere in the Mid-South, whether the government in your area is requiring it of you or not, because we're all in this together and we all are using the same healthcare systems. We're all relying on the same places. So whether you live in Shelby County, Crittenden County, DeSoto County, Tate County, Tunica County, Haywood, Fayette, Tipton, wherever you live, if you're within the sound of our voice, we ask you to please wash your hands, socially distance, wear a mask, whether anybody's making you do it or not.
Thank you, everyone. This concludes our time available for today's briefing. Please stay safe and healthy, and we will see you next time.